Facebook world.
Hi.
Hello, hello, hello. I hope some of you can catch us live today. Welcome to Talk About It Tuesday. I don't even know what episode. I think this is episode 8 or 9, which means I've been doing this for 2 months now, which is awesome. So thank you everybody for watching. Again, this is Talk About It Tuesday. I am Carolyn Spronley. I am your residential real estate agent with Keller Williams on the Water here in Sarasota.
Hi everyone, thanks Carolyn for having me today. I'm Kim Bociek, Acupuncture Physicians Group.
Yes,
I'm thrilled to speak to you all.
Yay! We're so excited to have you. She's an acupuncture physician here in Sarasota, and her office right now is right off of Bay Vista, so it's very, very convenient for you. And today, she's going to help us debunk acupuncture myths.
That's right.
I know you come across it all the time, why people don't come see you, and I run into it all the time because I ask people to go because it's really, really important to go. We need to talk about some of these myths and why people don't go.
Yes, ma'am.
So Dr. Kim's going to help us with that today. So our first myth is that acupuncture is painful. Is it painful?
It is not painful.
Not! Well, how is it not painful? I mean, it's needles, not needles.
Oh, so you can fit about 35 or 40 of those suckers in the tip of a hypodermic needle. And these things are super, super thin.
You see?
Smaller than a strand of hair.
Real thin.
A couple of strands of hair. 35 of those fit into a hypodermic needle. So teeny, teeny, tiny.
So when they're using the needles for acupuncture, it's so tiny, just a few strands of hair. That's how thin the needle is. So painful? No, definitely not painful. And I can attest to that. She's worked on me. It's actually really relaxing to sit there with needles sticking out of you.
Thank you. It releases your endorphins, your serotonin.
It's great. It's awesome, awesome, awesome. So myth number 2, that it only treats pain. So does acupuncture only treat pain?
And the answer is, what does the public say? No.
No,
it does not only treat pain. Of course, that's a primary source of patients that I see from all levels of migraines to headaches to back and hip and shoulder and knee. And that's common across the board. Anxiety, depression, insomnia, immune issues, allergies. With red tide nowadays, we're having all these sinus issues and throat issues and blocked up nasal cavities. And
do you want to tell your story?
Rheumatoid?
Try not to cry.
Try not to cry.
So Dr. Kim got into acupuncture because of her own illness. And it wasn't, I mean, I guess you were in pain, right?
But insufferable pain.
But it's an autoimmune,
yes,
right?
Yes.
Rheumatoid arthritis. So tell us, how this happened.
So my initial flare-up was so brutal, I had difficulty holding a brush to brush my own hair and turning a doorknob. And I went to the medical doctors, and of course you do all the labs and you
medicine.
And I did Humira and Plaquenil, methotrexate and Vioxx and some prednisone. And then I found acupuncture. And it didn't happen immediately because it's a chronic issue and it's inflammatory. And acupuncture accelerates your body's own innate healing experience. Yeah. And with that and proper diet change and gut health, you can heal your own body too. And I could cry because I'm so thankful.
That's just so amazing. So people are freaked out to go to acupuncture, and here it is healing an autoimmune disease that people are still suffering from, and they're just ingesting. I mean, don't get me wrong, you need them sometimes, right?
You need them when you need them, absolutely.
No doubt. This is holistic, it's not painful, and look at her. She's amazing.
15 years or more remission, so
it's amazing.
I'm blessed and thankful, and make me cry.
Yay, acupuncture!
Oh.
All right, so it only treats pain? Absolutely not. Depression, anxiety, autoimmune disorders,
insomnia, digestion,
anything,
constipation,
anything. And she has this really cool tool that'll help you see even the things that you don't even know. But
that's for another day.
Yeah, come in and check that one out. So the third myth is that you only use needles.
The consensus says negative. So in our little toolbox, we have all kinds of toys, and we have Chinese medicine, We have Tuina, which is a form of massage, gua sha. Everyone seems to be knowing about cupping these days.
Mm-hmm.
Injection therapy, electric stim. So
Cupping,
we have a lot
cupping,
of resources to help your body heal.
I brought my daughter when she was 1.5 years old. I had gone to the doctor numerous times.
Love her.
She had what I call the lung junk. And
Yep.
so, lots of mucus and coughing and just pretty miserable and tough to breathe and wheezing. And so I guess this is a couple years now because she's almost 3. And I brought her to see Kim, and she did cupping because it's very sensitive for the little ones. They're not able to lay down and relax like we can. And then ear seat, what are they called?
Ear seats.
Ear seeds, which also hit your acupuncture pressure points.
Yes.
And open channels.
Well said.
I'm learning
Good
things.
job.
Thanks. The next day, she was so much better than she was the previous days, taking the steroids and the breathing treatments and things like that. So anytime she's not feeling well like that, it's acupuncture and oils.
Great.
She hasn't been to the doctor in forever because of this holistic medicine, and
Go Elle.
Dr. Kim, she's awesome.
Thank you.
So really, I think the moral of the story here that we want to tell everyone about is that it's not scary, and
It's safe. It's effective.
safe.
It's proven. It works.
it's preventative.
It's preventative.
So if you're playing tennis and you hurt your elbow or something, you can still get help. But you might not have gotten that injury had you been already using acupuncture. So it's really important to look into it, guys. It's another avenue of health. Talk About It Tuesday is for you. It's for information for everyone, so you can learn. And sometimes we're silly and I'm ballroom dancing, right? But other times we're learning about things that really can help you. And thankfully, I have some really, really great people around me that are so into
Carolyn,
We
thank
love
you
you.
for today.
Of course. And so really, guys, if you're scared, you don't know, you don't need to be scared. If you're still scared,
Come see me. I'll help you
give
out.
Dr. Kim a call. Her information's up top. She'll definitely be able to help you, point you in the right direction. And it doesn't hurt.
And I
And
love
it
talking about
works.
this till the day is long. So
Yeah,
come
I
on
mean,
in, chit chat.
Look how smart she is. You see this ear behind us? Those are all acupuncture points that do different things.
things.
I don't know. What's the other? Reflexology. If some people have heard of reflexology with those points, it's similar to that, I guess. But there's so interesting. It's so cool. So I hope this was helpful for you. Again, this is Kim Bociek.
Loved being here. Thank you for having me, everyone.
She's an acupuncturist right here in Sarasota, so please get in touch with her. If you have any problems at all, really, I mean, it's so vast. Whatever you have an issue with, it probably can help, So give her a call. I'm Carolyn Spronley. I am your residential real estate agent.
The best.
Call me with any questions for anything because I have great people like this right at a phone call that I can help you and point you in the right direction. And of course, I can help you with any real estate needs if you need anything. And again, thanks for coming for Talk About It Tuesday. Thanks so much for all of the support. Please like and share this video if you find it interesting. Share it with someone who's in pain. Share it with someone who has anxiety. Share it with your grandmother who is bored. I don't know. Share it with everyone because it's important to get this out there. So thanks again. Thank you again. You're the best.
Thanks, everyone.
We'll
You're
see
awesome.
you again next week for Talk About It Tuesday. Have a great Tuesday.